Hi there, Archer nurses. This week I want to talk to you guys about safety. It is so big on this Next Generation NCLEX. So we're observing a newly hired nurse applying bilateral wrist restraints. I want you to look at these actions. Which one would require follow-up if you observed from a newly hired nurse? If she was securing those restraints to the frame of the bed, repositioning the client from semi-Fowlers to prone, providing easy access to the quick release buckle, or assessing that radial pulse every 2 hours. Pause your video, jot down your answer, and then we'll review. The correct answer here is B. If my client is in restraints and I position them over to prone, there's actually a risk for suffocation. So this is not an appropriate position for the client who is restrained. It's also not great to put them in the supine position as it leaves them feeling very vulnerable. A, C, and D are all perfectly appropriate actions and not going to require me to follow up. A, securing to the frame of the bed, that's what I want to see. What we don't want to do is secure to that side rail, since that can move up and down and can become unsecure. For C, that quick release buckle is standard practice. Again, what we don't want is to be tying it in a knot that could be hard to get undone in case of a fire or some other sort of emergency where we need to get the client out quickly. And lastly, D, super important to check that radial pulse every 2 hours. We want to make sure we're assessing distal perfusion and that we're not cutting off circulation with a wrist restraint that is too tight. We'll be reviewing safety all week here at Archer NCLEX, so follow along and find more practice questions over at archerreview.com. See you guys there.